Nobody tries and fails vaginal hormones. There, I said it. I know it might be controversial. You're thinking to yourself, Dr. Rubin, I tried vaginal hormones and it didn't work for me. I'm going to call BS. Why? Because sometimes it's the type of vaginal hormones that you are using that your body didn't like, but there are others. And it is so important that you find a foundational vaginal hormone that will give you what you need to not get urinary tract infections, to not have pain with sex, to not have vaginal dryness. I'm Dr. Rachel Rubin. I'm a urologist and sexual medicine specialist, and we are devoted to answering all the questions about vaginal hormones. So please subscribe to our channel and tell your friends. Now, say you tried vaginal hormones and you got a yeast infection. That's okay. Treat the yeast infection, keep going, and move on. What happens is your body is starting to get acidic. The vaginal tissues are getting acidic, which will ultimately fight infection, but yeast likes to grow in acidic environments. What we find is that you may get a yeast infection when you first start vaginal hormones. It rarely happens, but it can happen. Treat it with diflucan, with whatever you use for your yeast infections, but don't stop the vaginal hormones. In about 2 to 3 months, you will maximize your microbiome and you will not have recurrent yeast infections. You shouldn't have recurrent yeast infections. And if you do, you need to see a very smart doctor who can really help you with this. What if you tried vaginal hormones and you had burning or irritation? Well, sometimes the vaginal hormone creams have chemicals in it which can cause burning and irritation. Because of your genitourinary syndrome of menopause, your tissue is thin, it's raw, it's irritated, and it hurts like a sunburn just to touch it. So you may not want to use a cream initially. There are vaginal suppositories, little vaginal pills, estradiol 10 microgram inserts that you can put in that are not messy or goopy and should not cause burning. Alternatively, vaginal DHEA or intrarosa is made up of palm oil and DHEA, so it can be more moisturizing and less irritating on your tissue. So it is really important that you find the vaginal hormone that works for you, and sometimes that takes trial and error and trying a few things in our toolbox, and we have 4 or 5 different products in our toolbox to help your sensitive tissue. So why is it important that you can't fail vaginal hormones? Because vaginal hormones are the foundation. They are the foundation and the building blocks for you to get better and for you to feel better. Your pelvic floor will never relax if you have a burning sunburn in your vulva and vagina. Your urinary frequency and urgency will not get better if the hormonal tissue is so raw and irritated. And so if you want to get better, we need to find the vaginal hormone that can support your tissue maximally. Now, if you've been told by your doctor that you can't have vaginal hormones, the question is, how much does your doctor know about this? Because I'll tell you, they do not teach oncologists anything about the vagina or the vulva. They do not teach primary care doctors anything about the vagina or the vulva and genitourinary syndrome of menopause. And so when you are told you can't have local vaginal hormones, it may not be true because your doctor may not understand the difference between very low dose vaginal hormones and whole body systemic therapy. And so many of the associations, the urology associations, the gynecology associations, even the oncology associations have all come out and said low dose vaginal hormones are safe to use when you have the genitourinary syndrome of menopause. And so it's really important that you understand this, that your doctor understands this, and that you know that you have not tried and failed vaginal hormones, that you just have to find the right one and keep going. It takes 2 to 3 months to work, and it will not work unless you continue to use it. Please ask us more questions. We will keep answering questions. We'd love to see your information in the comments, and please subscribe.